Right now, as you watch this, your liver is performing over 500 different jobs inside your body. It is filtering your blood, processing everything you eat and drink, making proteins that keep you alive, and managing toxins that would otherwise kill you. 500 jobs, around the clock, every single day, without ever asking for a break. And here is the part that most people never hear. When that liver starts to fail, it does not send you a loud, obvious alarm. It does not stop you cold with sharp pain in the night. It does not put you in the emergency room right away. Instead, it sends you tiny, quiet signals. Signals that are so easy to dismiss that most people, especially those of us over 60, chalk them up to just getting older. They blame their age. They blame a bad night's sleep. They blame stress. And the liver keeps quietly deteriorating, sending signals that nobody answers. I've sat across from patients who came to me too late, not because they didn't care about their health, because nobody had ever told them clearly what their body was actually saying. That is the most painful part of my job. Today, I'm going to change that for you. I'm Dr. Daniel Hayes, and I want to walk you through the 7 early warning signals your liver sends before things get serious. And I want to tell you up front, the one that most seniors completely miss is number 4. We are going to talk about that one in detail. By the end of this video, you will know exactly what to look for and what to do about it. Before we get into the list, I want you to do something for me. Type the word liver in the comments right now. It lets me know you are here with me, and it helps other seniors who need this information find this video too. Let's get into it. Before we talk about the 7 signals, I want to spend just 2 minutes helping you understand why seniors are especially vulnerable. Because this is not about being unlucky, this is biology. Think of your liver like the most powerful processing plant you have ever seen. Everything that enters your body, every bite of food, every sip of coffee, every pill you swallow, it all has to pass through this plant. The liver sorts it, processes it, neutralizes what is dangerous, and sends what the body needs into the bloodstream. Now here's what changes as we get older. Research published in studies of liver physiology shows that after the age of 60, the liver naturally shrinks in size, sometimes by as much as 20 to 40% compared to its peak years. Its blood supply decreases. Its ability to clear medications and toxins slows down significantly. Think of that processing plant running on fewer workers, less equipment, and reduced power, but with the same amount of work coming in every day. And here's the thing that makes it even more serious. The liver is one of the most silent organs in the human body. It does not have pain receptors the way your muscles or your skin do. You can lose up to 75% of your liver's function before clear, obvious symptoms appear. 75%. Gone. And you may have felt nothing dramatic at all. That is why these 7 early signals matter so much. They are not dramatic. They are not obvious. But they are real. And they are your liver asking for help before it is too late. Let's go through them, one at a time. Warning number 7. You are tired in a way that sleep doesn't fix. Now I know what you are thinking. Doctor, I'm in my 60s or 70s. Of course I'm tired. And I hear that. Tiredness is one of the most common things that gets blamed on age. But there is a very specific kind of fatigue that the liver produces, and it is different from normal tired. Normal tired gets better with rest. You sleep well, you wake up, and you feel restored. Liver-related fatigue does not respond to rest that way. You can sleep 8, 9, 10 hours and still wake up feeling like you have not slept at all. You feel heavy, foggy, like you are dragging yourself through the day even though nothing physically demanding is happening. This happens because when the liver starts to struggle, it cannot properly clear the metabolic waste products that build up in your blood. These waste products circulate and affect how your brain and muscles function. Your body feels the burden even when you are resting. Research consistently identifies persistent, unexplained fatigue as one of the earliest indicators of liver impairment, and one of the most frequently dismissed, especially in older adults. Here's the question I want you to ask yourself honestly. Is your tiredness getting better with rest, or is it staying the same no matter what you do? If rest is not restoring you, that is your body sending a signal. Write it down. Notice it. We will talk about what to do after we go through all 7. Warning number 6. Your skin is itching, but there is no rash. This one confuses people tremendously. They search their arms and legs for a bite mark, a rash, dry skin, something visible to explain the itch. They put on moisturizing cream. They switch their soap, and the itching continues because the cause is not on the surface of the skin, it is in the blood. When the liver is under stress, it can struggle to process bile properly. Bile is a substance the liver makes to help digest fats. When it builds up in the bloodstream instead of flowing the way it should, it deposits in the skin. And when bile salts sit under the skin, they cause itching. This This specific kind of itch tends to be worse in the evenings or at night. It often affects the hands, feet, and legs. And crucially, there is no rash, no visible cause, no explanation on the surface. The medical community refers to this as pruritus related to liver disease, and the British Liver Trust identifies it as one of the key skin-related symptoms to watch for. If you have been itching without explanation for weeks, and especially if it gets worse at night, do not assume it is just dry skin or your laundry detergent. This is a signal worth mentioning to your doctor. Warning number 5. Your sleep is disturbed, and you wake up in the middle of the night, often confused. Here is one that catches people completely off guard, because it looks like insomnia. It looks like anxiety. It looks like the kind of restless, aging sleep that we are all told is normal. But there is a pattern that stands out when the liver is struggling. You fall asleep fine, but you wake up, usually between 1 and 3 in the morning, and sometimes you feel disoriented. Not just drowsy, actually confused. Not sure where you are for a moment, not sure what day it is. Research into early liver dysfunction in the elderly shows that disturbed sleep and waking during the night are among the documented early signs of liver-related changes. And the explanation is not complicated. When the liver is not clearing toxins from the blood efficiently, those toxins, which are completely natural byproducts of digestion and metabolism, begin to accumulate slightly in the bloodstream. At night, when your body is supposed to be fully at rest and doing its internal maintenance, those toxin levels can creep up a little higher because the liver's processing speed is already at its slowest. The brain is sensitive to even small changes in blood chemistry. When toxin levels rise slightly, sleep becomes fragmented, dreams become more vivid or disturbing, and some people wake up feeling genuinely foggy or momentarily confused. In more advanced stages, this becomes a condition called hepatic encephalopathy. But the early mild version is subtle enough that it is very easy to dismiss as just bad sleep. If your sleep pattern has changed, if you are waking up in the night and feeling strangely foggy when you do, your liver may be part of the story. Warning number 4. Changes in your digestion. Specifically, you feel full very quickly or your stools have changed color. This is the one that most seniors miss. And I want to spend the most time here because the research is very clear on this, and yet this signal gets overlooked constantly. Let me tell you about a patient I'll call Margaret. She was 71 years old, still active, still cooking her own meals, still managing her own life with independence. She started noticing that she felt full after just a few bites of a meal. She thought her stomach was just shrinking with age. Maybe I just don't need to eat as much anymore, she told herself. Then she noticed something else. Her stool had become very pale, almost gray, like clay. She mentioned it once to her daughter, who suggested she eat more fiber. She mentioned it once to her pharmacist, who said it was probably a medication side effect. Nobody flagged it clearly for what it was. Pale, clay-colored, or gray stool is one of the most telling signals that the liver is not producing or releasing bile properly. Bile is what gives stool its normal brown color. When bile flow is blocked or significantly reduced, the color drains out of the stool. At the same time, urine can darken to a deep amber or brown color, because the waste products that were supposed to go into the bile are instead spilling into the urine. These two together, very light stool and very dark urine, form one of the most specific warning combinations for liver distress. And yet, in study after study, seniors report this change and attribute it to something they ate, something mild, something not worth worrying about. The rapid feeling of fullness connects here too. When the liver is under stress and beginning to enlarge, it can press on the stomach, reducing how much food the stomach can comfortably hold before you feel full. You eat 3 bites of a meal you normally enjoy and feel like you could not manage another. There is also research showing that early liver disease produces changes in appetite, nausea, and a general loss of interest in food, all of which get blamed on aging, medication side effects, or depression. I want you to pay attention to your toilet habits this week. Not to alarm yourself, but to inform yourself. The color of your stool is a window into what your liver is doing. If it is consistently very pale or gray, and especially if your urine looks darker than usual at the same time, that combination is specific enough to bring to a doctor immediately. Not in a month, not when it gets worse, this week. Margaret was eventually diagnosed with early-stage bile duct obstruction, caught early enough to treat successfully. She told me later that the signs had been there for months. She just did not know what she was looking at. Now you do. Warning number 3. Small spider-like veins appearing on your skin, or your palms turning red and blotchy. This is a fascinating one because most people either don't notice it or assume it is just a cosmetic change with age. Your liver is responsible for regulating certain hormones in the body, including estrogen. When the liver is struggling, it cannot break down estrogen as efficiently as it should. This buildup of estrogen in the blood triggers a very specific kind of change in small blood vessels near the skin surface. On the torso, shoulders, and upper arms, you may begin to see small red marks that look like a tiny spider, a central red dot with thin red lines radiating outward like legs. These are called spider angiomas, and while one or two in isolation may be harmless, multiple appearing over a period of weeks or months is a documented sign of liver stress. At the same time, the palms of the hands can become red and blotchy, particularly at the base of the thumb and pinky finger. This is known in medicine as palmar erythema, redness of the palms, and it is directly linked to changes in blood flow and hormone regulation tied to liver function. These changes are painless, they do not itch, they do not cause discomfort, which is exactly why they get dismissed or attributed to skin changes from aging. If you notice multiple small spider-like marks appearing on your upper body, or your palms have developed a persistent redness that was not there before, take a photograph and show your doctor at your next appointment. These are quiet but meaningful signals. Warning number 2. Your belly is swelling, but your weight otherwise isn't changing much. This one is deeply uncomfortable to talk about, and I want to handle it with care, because belly swelling from liver disease is very different from normal weight gain, and the difference matters. When the liver is significantly stressed over time, it can begin to scar internally. Imagine a wound on your skin that heals with scar tissue, slightly thick and stiff where it was once soft and flexible. The liver goes through a similar process when it is repeatedly damaged and trying to repair itself. Over time, this scarring can interfere with blood flow through the liver. When blood cannot move through the liver freely, it backs up into the veins and begins to push fluid out into the abdominal cavity. This fluid accumulation in the belly is called ascites, and it can cause the abdomen to swell quite noticeably, while the arms and legs remain relatively unchanged. People often describe it as suddenly looking puffy in the middle, or feeling like there is pressure in their belly that was not there before. The belly can feel tight. Bending over becomes uncomfortable. Lying flat at night feels unusual. Here is the distinction from normal bloating or weight gain. This kind of swelling does not come and go with meals. It does not ease by the morning. It stays, and it can gradually get worse over days and weeks. I want to be very clear. If your abdomen is swelling in this persistent, progressive way, especially if it is accompanied by any of the other signals we have discussed, this requires a medical evaluation as soon as possible. This is not a symptom to watch and wait on for months. Warning number 1. Your eyes or skin are turning yellow. I put this one first, meaning the most urgent, not because it is the first to appear, but because when it appears, it means the liver is sending the loudest signal it knows how to send. This yellowing is called jaundice. It happens when a yellow substance called bilirubin builds up in the blood. Bilirubin is a normal byproduct that forms when old red blood cells are broken down. Under normal circumstances, the liver captures this bilirubin, processes it, and sends it out of the body through the stool. That is partly why healthy stool is brown. When the liver cannot process bilirubin properly, either because it is damaged, blocked, or overwhelmed, bilirubin stays in the blood and begins to color the tissues it reaches. The first place people notice it is the whites of the eyes. They take on a yellowish tint. Then the skin, particularly on the chest, face, and inner arms, can develop a yellow or slightly orange tone. Mayo Clinic identifies jaundice as one of the primary symptoms of both acute and chronic liver failure, and the Cleveland Clinic notes it as among the most specific warning signs of liver disease progressing to a serious stage. Here is what I need you to remember. Jaundice is not a symptom you investigate at your leisure. It is not something to photograph and show your doctor next month at a routine checkup. Yellowing of the eyes, even a subtle yellowing, combined with any of the other signals we have discussed today, is a reason to call your doctor today, not tomorrow, today. Jaundice is the liver waving a white flag, and it deserves an urgent, direct response. So let's bring all 7 together, because I don't want you to leave this video overwhelmed. I want you to leave it equipped. Here are the 7 signals in order. Number 7. Persistent fatigue that does not improve with rest. Number 6. Unexplained itching with no visible rash, worse at night. Number 5. Disturbed sleep with nighttime waking and foggy confusion. Number 4. Feeling full very quickly, pale or clay-colored stool, and dark urine, the one most seniors miss. Number 3. Spider-like red marks on the upper body or red blotchy palms. Number 2. Swelling in the belly that does not come and go. Number 1. Yellow tint in the whites of the eyes or on the skin. None of these alone automatically means liver failure. Some of them have other explanations entirely. That is not the point. The point is this: your body communicates. It uses signals. And the liver communicates earlier than most people realize. It just communicates quietly. Most seniors are never taught to listen for these specific signals, and so those signals go unanswered for months or even years. I want you to do 4 things after this video. First, go look at your eyes in the mirror. Just the whites. Look at them in natural light, not bathroom light. Are they clear white, or is there a slightly yellow tinge you have not thought about before? Second, think back over the last 30 days. Has your energy been different in a way that rest is not fixing? Have you had any changes in your digestion, particularly your stool color or how quickly you feel full? Third, the next time you see your doctor, ask specifically for a liver function test. This is a simple blood test. It is not expensive, it is not complicated, and it can reveal what is happening inside the liver long before any visible symptom becomes severe. Many seniors have never had one. Ask for it by name. Fourth, if you are experiencing warning number 1, the yellowing of the eyes, or warning number 2, the persistent belly swelling, please do not wait for a scheduled appointment. Call your doctor's office today and describe what you are seeing. These 2 signals specifically warrant urgent attention. Now I want to give you something practical, because knowing the warning signs matters, but protecting the liver before those signs appear matters even more. The liver has a remarkable ability to repair and regenerate, more so than almost any other organ in the body. That is the good news. And there are things you can do every single day that directly support that repair process. Water. The liver needs water to filter blood and flush toxins. Most seniors are mildly dehydrated without knowing it because the sense of thirst naturally diminishes with age. 6 to 8 glasses of plain water per day, not juice, not soda, not coffee, supports the liver's work more than most people realize. Reducing unnecessary medications. This one requires a doctor's guidance, but it is important. The liver processes every single medication you take. Over 60, many people are taking 4, 5, 6, or more medications daily. Each one adds to the liver's workload. Research on aging and liver physiology shows that the liver's ability to process medications slows significantly after 60. If you have not had a medication review with your doctor recently, a conversation specifically about whether every medication you take is still necessary at its current dose, that conversation is worth having. Limiting alcohol. There is no gentle way to say this. Alcohol is processed entirely through the liver. Research specifically on elderly patients with liver disease shows that alcohol-related complications in people over 60 are disproportionately severe compared to younger adults. If you drink, even moderately, and you are experiencing any of the 7 signals we discussed, reducing or eliminating alcohol is one of the most direct protective steps available to you. Food choices. The liver processes everything you eat. A diet high in processed foods, refined sugars, and fried foods creates constant, heavy work for the liver, particularly when it comes to managing fat storage. Fatty liver disease, where fat accumulates inside liver cells, is increasingly common in adults over 60 and can progress silently for years. The shift toward more vegetables, whole grains, lean proteins, and healthy fats like olive oil is not complicated dietary advice. It is direct liver support. Regular blood tests. A liver function panel, which measures specific enzymes and proteins in your blood, is the most reliable early detection tool available to you outside of imaging scans. Ideally, after 60, this should be part of your annual blood work. If you have not had one recently, make a specific point of asking for it. I want to leave you with one more story before we finish. A man named Robert, 67 years old, retired school teacher, proud gardener, came to see me after his daughter practically dragged him in. She had noticed something in the whites of his eyes during a family dinner and had insisted he come. Robert had been tired for months. He had been waking up at 2 in the morning and feeling confused for a few minutes. He thought it was just vivid dreams from a new medication. He had noticed his stool was paler than usual, but figured it was something he had eaten. He had never connected any of it together. None of the signals had been dramatic enough, on their own, to alarm him. When we ran his blood work, his liver enzymes were significantly elevated. An ultrasound showed early-stage scarring. Not irreversible, not requiring a transplant, but absolutely requiring action, and requiring it now rather than a year from now. Robert started treatment. He changed his diet. He reduced alcohol. He had a medication review. He came back 4 months later and his blood work had improved meaningfully. He told me, "I had no idea my liver was trying to tell me something. I thought tired was just tired. I thought bad sleep was just age." He had been receiving signals for months. He just had not known what they meant. Now you do. You have something Robert did not have when he walked away from that family dinner. A complete picture of what the 7 signals look like and what they mean. The liver is working for you every second of every day. It deserves the same attention in return. If this video helped you today, I want to ask you for one small action. Not a subscription, not a like, though both of those help more people find this information. I want you to send this video to one person over 60 in your life. A spouse, a sibling, a friend who tends to wave off symptoms and say they're fine. One person who might be receiving signals right now and dismissing them as nothing. Because what changed for Margaret and what changed for Robert was simply information. Someone finally gave them a clear, complete picture of what their body was trying to say. You now have that picture. Pass it on.